Thank you so much for the opportunity to speak today in support of Bill 225. My words will echo many of those of the eloquent and passionate speakers you've already heard tonight, so bear with me. I know it's getting late here. My name is Dr. Jina Pagura, and I am a pediatrician and a parent here in Winnipeg. My support of this bill stems from both my personal and professional experiences. Reading did not come naturally to my son, despite my husband and I reading books to him daily since he was an infant. He has always been smart, and I assumed he would pick things up easily in school. However, it became clear to me by grade 2 that he was not picking up on the vowel sounds or phonics that I assumed he was being explicitly taught. His reading instruction was centered on cue-based strategies. Example, look at the first letter and picture and guess the word, rather than on explicit phonics. For example, how the short A sound says ah, like an apple, and how the long A sound says A, as in cape. The cue-based strategies did not work for him. Reading was not joyful, and he asked me if he would ever love to read like I did. As a pediatrician, I was in a privileged position to pick up on these struggles and look for assessment and tutoring outside of school. With direct instruction, using a structured literacy approach that focused on phonics and decoding, his reading and writing improved. Reading and writing became fun. It was no longer a painful struggle. He did not have an underlying learning disability, but rather he was what we could describe as an instructional casualty. His incredible tutor made his learning exciting and opened up the world of reading for him. When I brought up my concerns to my son's teacher, prior to seeking out assessment and tutoring privately, I was told that he was exactly where he should be and that there were no concerns with his reading or writing. And I say this with no intention to place blame. My son was not screened with an evidence-based screening tool that could have picked up on those struggles. I'm well-versed in screening tests and their requirements based on my medical and research training. Just as we don't expect physicians to pick up certain diseases without a valid screening tool, as an example, the use of pap smears in screening for cervical cancer, nor should we expect teachers to pick out all struggling readers without valid and reliable screening methods. Such tools are available for this exact purpose, and Bill 225 aims to put these in the hands of teachers so that they can be utilized. These methods will pick up all struggling readers and allow the opportunity to provide early intervention. In my pediatric clinic, I see children frequently who are struggling with reading or who are eventually diagnosed with learning disabilities. These children sometimes present to me because their parents are worried about their reading, but so often it's other concerns like mental health struggles, just profound fatigue, concerns with possible inattention or depression. If reading challenges are not addressed early on, these children fall further and further behind, making it more and more unlikely that they will ever catch up. Low literacy in adulthood is associated with multiple negative health outcomes, some of which we've heard about already today, including lower educational and career attainment, poorer general health, mental health issues, substance use, and incarceration. Statistics from the Canadian government show that a staggering 42% of Canadians between the ages of 16 and 65 fail to attain a level of reading skill typically required for high school completion. Data from our own province available on the Manitoba government website shows that only 44.9% of children in this province are meeting expectations for reading in grade 3. And even worse, only 22.5% of children from northern regions and 27.7% of children of self-declared Indigenous identity are meeting these expectations. This is unacceptable. The current barriers for families facing literacy challenges are vast. Parents who cannot read well themselves or who trust that issues will be brought up by the school may be completely unaware that their child is struggling. Mandating evidence-based screening starting in kindergarten ensures that all children with these challenges are identified. Once those issues are identified, instruction and intervention also need to be evidence-based. Despite the fact that it is well established within the scientific literature that phonics-based instruction or structured literacy is the most effective method for teaching the decoding skills necessary for literacy, this is not mandated in all schools in Manitoba. At present, many families resort to private assessments and tutoring, which are extremely costly and simply inaccessible for many families. This only widens the gap between those who can afford these assessments and interventions and those who cannot. This disproportionately affects racialized children, new immigrants, and those of lower socioeconomic status. Both the Manitoba Pediatric Society and the Canadian Pediatric Society have recognized the need for evidence-based literacy screening instruction, and intervention, and I've provided copies of those statements for your review. I would strongly suggest that school districts be given direction in terms of which measures are valid, reliable, and appropriate for use for universal screening, such as DIBELS or Acadience reading measures. Next steps include mandating evidence-based instruction and intervention methods. Bill 225 is a step in the right direction towards systemic change within Manitoba public education to ensure that evidence-based approaches to screening, instruction, and intervention are available to all learners. This is an issue not only of education, but of optimizing the health of all Manitobans. Literacy is a fundamental, basic human right, and all children have the right to be taught how to read effectively in a publicly funded education system. Thank you for your time.
Thank you, Dr. Pagura. Emily Lamoureux.
Thank you for your presentation here this evening, and I actually have two questions for you. You can pick and choose if you'd like. I was wondering if you could speak just a little bit more to your experience and perspective as a pediatrician and what you are seeing here in Manitoba, as well as why it's important this is mandated, as you say, and put into legislation, not just verbalized.
Dr. Pagura.
Absolutely. I think for pediatricians, so much of what we see these days is increasing mental health issues. And so much of that can be tied back to a lot of these issues and struggles with learning. One of my mentors talks often about how we had a meeting with some of the psychiatrists talking about how can we improve the mental health of kids in Manitoba, because it's very challenging. The resources are not available and medical treatment only goes so far. And really his answer was literacy. Teach them how to read, and this will help. And so I think it's a core thing that we can do that should be done. And I think mandating it is important, like we said, so it's an ongoing commitment and it's something that is going to remain. I think there needs to be room for evidence because science changes. We learn things, we know that things can change, and that's part of the scientific process. We learn, we do better over time. And so there needs to be room for that flexibility, but I think it's really, really important that anything that is mandated needs to be reviewed with experts in that content area that can really speak to the scientific evidence for those measures.
Thank you, Dr. Pagura. Minister Schmidt.
Thank you, Honourable Chairperson. Thank you so much, Doctor, for your presentation, for taking your time out to be here with us tonight and share your expertise and your opinions and your experience with us. I agree with you wholeheartedly that mandating early screening is essential. That's why our government took immediate action and has done so, not just in K-3, but all the way to grade 4. And I also agree with you that there is a need. You mentioned the need for flexibility. And I think that's one reason why a ministerial directive in this case provides us that flexibility. We have mandated that a universal screening tool is required, and I just wanted to provide you some assurance that how closely our department is working with school divisions and making that selection. It is absolutely not a free-for-all. We have a list, and we're working closely with school divisions. You mentioned DIBELS. That is one of the one that we are actively promoting. Many school divisions are already using, and so we're working with school divisions to find those best practices while also providing them and leaving them with that
Minister
flexibility.
Schmidt. Sorry, we're at the end of our 45 seconds there. Yeah. Dr. Pagura, did you want to respond to what was said?
Thank you. I'm very happy to hear that.
Emily Cook.
Thank you, Dr. Barrage. Time to share your expertise and also for providing written material, because that's very helpful. No, this is great for us to refer back to later, so thank you very much.
Any further questions? Thank you for your presentation, Dr. Pagura.